Thank you for joining us, Madam Secretary. I'd like to begin with something the President said at a town hall out in Colorado yesterday. Among the most contentious points of the debate, and something the President once described as critical, is the so-called government or public option to compete with private insurance companies. But if you listen to the President yesterday, he seemed to think maybe it's not so important.
The public option, whether we have it or we don't have it, is not the entirety of health care reform. This is just one sliver of it, one aspect of it. And by the way, it's both the right and the left that have become so fixated on this that they forget everything else.
Now, some, Madam Secretary, take that as a simple statement of fact because you don't have the votes right now in the Senate for the public option. But some in this town, in Washington, especially House Democrats, more liberal Democrats, who have said that is critical, that they will not support health care without a public option, they take that as a message from the President that the votes aren't there, it's time to come up with a plan B.
Well, I think, John, that the President is absolutely right. This piece of the puzzle has had enormous focus, and the President continues to believe that it's good to have consumer choice, let people choose an option in the new marketplace, and it's good to have competition for the private insurers who will inherit a lot of new customers, and without competition, costs could skyrocket. In a monopoly system, it's not a great way to hold down costs. So he continues to be very supportive of some options for consumers. What we don't know is exactly what the Senate Finance Committee is likely to come up with. They've been more focused on a co-op, not-for-profit co-op as a competitor as opposed to a straight government-run program. And I think what's important is choice and competition. And I'm convinced at the end of the day the plan will have both of those. But that is not the essential element.
So is the President trying to say to, you know, the votes in the House and you know the support among liberals, and they're angry, they think they're being sold out in the Senate. Is the President trying to say, I'm sorry, the votes aren't there, yet be prepared to embrace a co-op instead of a more robust public option?
Well, the way the process works, the Senate will have a version. The Help Committee has already come out in the Senate with a version that has a very robust public option. It's the same version that's in the House-passed bills. What we don't know is the final committee structure, and I think the President is just continuing to say, let's not have this be the only focus of the conversation. Coverage for all Americans, lowering the crushing costs for everyone, making sure that we have new rules for insurance companies, that they can't dump people out of the marketplace if you get sick, that they can't drop your coverage based on a pre-existing condition, that you can't be priced out because you're a woman instead of a man, and gender discrimination won't be allowed to continue anymore. Those are really essential parts of the new program, along with choice and competition, which I think we'll have at the end of the day.